You're listening to Health Professional Radio. Thank you so much for joining us for another segment. I'm your host, Neil Howard, and we're going to be speaking with Dr. David Goldsteen. He's joining us here from VigiLanz to talk about the findings of their third annual survey with healthcare providers as it concerns staff and patient safety. Welcome to Health Professional Radio, Dr. Goldsteen. Thank you for taking the time.
Thank you, Neil.
Let us in on a little bit of your professional background. Tell us a bit about who you are and your current role at VigiLanz.
Well, I started out as a physician. I'm an internist by training. I practiced emergency medicine for about 15 years before migrating into the business world. So we started VigiLanz back in 2001, and I'm actually an accidental CEO at VigiLanz. I had a CEO that we had to let go. I became interim CEO in 2005 and just kept on as interim CEO until we dropped the interim title.
Great.
So I remain as chairman and CEO of VigiLanz.
Now, I understand that VigiLanz recently conducted its third annual survey among hospitals and health leaders and how they're prioritizing and approaching patient and staff safety. Could you tell us a bit about this survey and some of the key findings?
Certainly. So we conduct our annual survey in the spring of every year. This year it was in March. And we survey a broad range of health care leaders, including pharmacists, infection preventionists, quality leaders, CEOs, and CMOs. And we compare and contrast to our prior surveys, and found this year something of interest. For the first time in several years, patient safety is a higher strategic priority than improving efficiency and reducing costs. And hospital leaders also said that they're placing more emphasis on decreasing hospital-acquired infections and improving staff safety in 2021 than in years prior. So it's interesting to note that even before the pandemic, Neil, we were starting to see positive momentum related to how hospital leaders were prioritizing patient safety. For example, in our surveys, the percentage of hospital leaders who selected improving patient safety as a top strategic priority increased over the past 3 years from 40 to 50 to 57% this year. And at the same time, the hospital leaders who had previously selected increasing efficiency and reducing costs has decreased over the past 3 years from 60% in 2019 down to 50% in this year's survey. So we found all of that to be of significant interest.
Now that the virus seems to be stabilizing, hopefully stabilizing and declining, do you think that patient and staff safety is going to continue to be front and center going forward?
One can only hope. I believe so. I think there's a new normal throughout the world, as we all know, and I think in healthcare especially, we've learned a lot of lessons over the course of the pandemic. There are certainly early indications that hospitals are already moving in this direction. They're investing in initiatives like clinical surveillance that is more on the leading edge, as well as blocking and tackling on the basics, for example, on their PPE issues that many hospitals faced, in making sure they have adequate supplies to keep their patients and staff safe. 2/3 of respondents in this year's study are already either using, for example, the clinical surveillance technology or plan to implement it in the next 2 years. And that's forward-thinking, leading-edge technology. So I believe that we're seeing a true seismic shift in our approach and even definition of safety.
Do you think some of the lessons learned from this pandemic are going to help us when hospitals become overwhelmed for any reason in the future, as they have before? Nothing like this that we've seen, but some of these, I guess, safeguards should remain in place, don't you think?
Absolutely. Absolutely. Historically, we've used things like mass casualty events, tabletop scenarios to ensure that we had all of our bases covered. And we haven't done that for pandemics. In this case, we had a real pandemic to do it for us. So we've learned a lot of lessons, and I believe those lessons will carry over into many aspects of patient care.
Although you've talked about some of the things that are in place, that are going to be put in place as a result of some of the findings of this survey, do you think that clinical surveillance technologies are going to address some of these safety challenges more efficiently, especially now with telehealth being so prevalent?
I think the sheer volume of data and the rapidity with which that data flow throughout healthcare always carries an inherent risk of missing things. So clinical surveillance, in essence, is a great tool to support clinicians in the care of the patients. It should never replace clinicians. But clinicians are faced day to day with more and more challenging amounts of data, challenging diseases, since more people are ill today in hospitals than historically, of course. And it's ought to become a basic tool, as well as the real-time analytics that ought to be integrated through the clinical surveillance into the workflow of the clinicians to help guide them.
Now, you mentioned some of the challenges, the diseases, that sort of thing, but what about within the healthcare space itself? Things that have nothing to do with disease, but with management, with managing all of this data. How much of those things are going to affect patient safety and staff safety?
I think that the operationally, the hospital leaders recognize the interaction between how the data is generated, how the data is consumed, how the data is analyzed, and how it gets into the workflow as being essential today to the simple operations of the hospital as well as patient care. And I see more and more prioritization. And the hospitals are facing new and unexpected challenges on a more frequent basis. And it is transforming how hospital leaders think about safety itself, about data analysis, surveillance. And the pandemic itself revealed the gaps and vulnerabilities and that we had. But because of I believe, prior to the pandemic, because of the surgence of clinical surveillance, the hospitals were able to adapt relatively quickly. If one thinks about historically how well we performed during this pandemic, I think it's a tribute to how well the healthcare leaders had, perhaps fortuitously, because of their prior adoption of advanced technologies like surveillance, were able to better handle the pandemic than they previously would have.
Well, can you give us a website in wrapping up where our listeners can learn more about VigiLanz and also maybe peruse some of the results of your research as well, your survey as well?
Sure. Certainly your listeners can go to vigilanzcorp.com. That's VigilanzCorp.com, which is our comprehensive website.
Well, I appreciate you joining us here on Health Professional Radio. Thank you so much.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. David Goldsteen, CEO of VigiLanz. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.